health is the most important investment of our lifetime. In the United States, one person every 37 seconds dies from cardiovascular disease. A key contributor to heart disease is tobacco use. According to the Center for Disease Control and Prevention, exposure to secondhand smoke causes an estimated 41,000 deaths among adults in the United States. It is the third leading cause of preventable death in the United States. In LA County, over 500,000 non-smoking adults and children are exposed to secondhand smoke. Secondhand smoke compares to the same health risks as firsthand smoke. Secondhand smoke is smoke or aerosol exhaled from smokers smoking tobacco, marijuana, or vaping products. Secondhand smoke contains more than 7,000 chemicals, and at least 70 of them cause cancer. Secondhand aerosol from vaping products contains volatile organic compounds and high concentrations of fine or ultrafine particles. Ultrafine particles can travel deep into the lungs, where they become trapped and may lead to tissue inflammation. Adults exposed to secondhand smoke are more likely to develop lung cancer, heart disease, stroke, and respiratory diseases. For children, exposure to secondhand smoke can also cause sudden infant death syndrome, bronchitis, pneumonia, ear infections, and asthma attacks. Even your pets are subject to health effects of secondhand smoke, including cancer, skin allergies, and asthma. The purpose of a smoke-free outdoor area policy is to change social norms surrounding tobacco use and indirectly influence current and potential future tobacco users by creating a social atmosphere and legal climate where tobacco becomes less desirable, less acceptable, and less accessible by reducing exposure to secondhand smoke in outdoor areas. Currently, Cerritos does not have a local policy to help reduce secondhand smoke in public areas, making residents more at risk to secondhand smoke exposure. California law, Government Code Section 7597, prohibits smoking in an outdoor area within 20 feet of a main exit, entrance, or operable window of a public building, but not privately owned buildings. 90% of Cerritos residents support a total ban of smoking in outdoor dining patios. 87% of Cerritos residents support a total ban of smoking in common areas, such as around doorways and windows or within 25 feet of privately owned buildings. Secondhand smoke is an issue in Cerritos that affects residents and visitors. A survey conducted among 516 Cerritos residents reveals that 93% of respondents have been exposed to tobacco, marijuana, or e-cigarette secondhand smoke in outdoor areas. 94% of Cerritos residents believe secondhand smoke can interfere with their enjoyment of life. We believe that everyone deserves to breathe smoke-free air. Studies have shown that smoke-free laws that prohibit smoking in public places, like bars and restaurants, help improve the health of workers and the general population. 90% of Cerritos residents support a total ban of smoking in outdoor dining patios. Smoke-free policies do not harm businesses or tourism. The CDC's Community Preventative Services Task Force review of over 170 studies found that smoke-free policies do not have an adverse economic impact on businesses, including bars, restaurants, or establishments catering to tourists. Some studies found a positive effect of smoke-free policies. Smoke-free restaurants in California had a 16% median increase in sale price compared to restaurants in communities where smoking was permitted. Cerritos residents, you deserve to breathe clean air. If you have been affected by this issue and would like more information, please join our coalition. To learn more about smoke-free outdoor areas in Cerritos, please contact us. You too can make a difference to healthy living and healthy futures.